Who can I call?
What department can I go to?
How do I get help?
We need help.
What can I do?
Welcome to In Touch with Pinellas County. I'm Jane Merlin for Pinellas County Health and Community Services. Today we're in touch to learn about medical care on wheels. You may have spotted the rolling medical van on the road and wondered where it's headed and who's on board. Dale Williams, Program Analyst with Pinellas County's Health and Community Services, is here to tell us more about the mobile medical unit. Welcome, Dale.
Thank you, Jane. Thanks for having us.
It's wonderful that you're here. Tell us how long you've had a mobile medical unit in Pinellas County.
Jane, we've had a mobile medical unit in Pinellas County since 1988, and we're currently using our fourth generation van.
And who uses the unit, and what are the costs associated with it?
Anyone who's homeless in Pinellas County can use the van, potentially. We do have an income limit. We go up to 200% of federal poverty. Those details about the income can be found on our website at www.pinellescounty.org/human services. And the cost, generally speaking, is free. Those folks that qualify for services on the homeless van, it's without charge.
And so when we talk about that poverty level, we're really talking about people who literally either have no income or it's extremely small.
This is correct.
Okay.
Yes.
What kind of medical services are available on the van?
Well, Jane, we do a variety of things on the van. The main thing that we provide is primary medical care to include testing, blood work. We provide nutritional education. We provide prescription assistance to support the primary care function. We provide behavioral health care referrals. We provide specialty care referrals for medical issues that exceed the capacity of the primary care.
And so you mentioned lab work. They actually do the lab work, the blood testing and all of that right there on the van?
Actually, no. We send our clients to, we have contracts with local providers for lab and testing. And without going into a whole lot of detail, there's a computer way to request and a computer way for the testing results to be fed back to our doctor. But to your question, no, we don't provide those services directly on the van, but our clients get those services.
Now, and you mentioned that there's a primary physician on the van. Does that physician stay with that patient throughout their medical care treatment?
I think that's one of the most crucial aspects of the care that we're providing to our population, is that they have an oversight. They have someone that's following their care and responding to the test results that come back, and yeah, they follow that patient through the resolution of their medical issues. Which
is really important to have that consistency and somebody who knows their particular case.
Absolutely. That's what's lacking in a lot of these cases, is that there's just no follow-through.
Now, you said something earlier that kind of caught my interest, and that was talking about the educational component of nutrition. Why is that so important?
Well, oftentimes what we see on the van are things like diabetes, hypertension, things of that nature, and we see folks presenting with those issues that the diet that they have is either not helping that condition, or in often cases exacerbating it and making it worse. So in conjunction with drug intervention, insulin, etc., we have to basically say, look, we in order for you to get the best outcome, we need you to adjust your diet to accommodate your medical condition.
And there's been so much in the news, especially recently, about the importance of good nutrition and how it relates directly to somebody's health condition.
Absolutely. I mean, it really can't be understated, the importance of proper nutrition, especially when you're dealing with a medical condition like hypertension and diabetes. I mean, it's a direct it doesn't help things, and often cases it just makes it worse.
And often counterproductive to
Absolutely.
The situation that they have.
Yes.
Are you all able to take care of emergencies on the van?
We have a limited capacity, depending on the severity of the situation. For instance, if someone presents with a wound that's amenable to dressing, medication application, yes, we can handle that. There are situations, unfortunately, that far exceed our treatment capacity on the van, and in those cases, we in the one hand, send the person to see a specialist if that condition can wait for that process. There are some instances, though, where we have no choice but to send that person to the hospital, call 911 to get them to, urgent care.
Now, you mentioned earlier specialty care. Can you give us an example of what that means?
Sure, I can give you a couple. The main one that most people can understand is a arm fracture or a leg fracture that requires surgical intervention. An orthopedic surgeon is a specialist. Another example would be an oncologist, someone that treats cancer. Those doctors are a higher level specialty than a primary care doctor.
So you all are really more looking at the preventative kinds of care and maintenance, good health maintenance?
Yeah, absolutely. We are a primary care function, and we get the patient to the proper specialty care. But again, back to the monitoring thing, we're orchestrating that and following that through to resolution.
And how is the medical van funded?
It's a good question. The medical van is funded through a grant from the Health Resources and Services Administration. It's also known to folks as the Bureau of Primary Health Care. It's a division of the U.S. Department of Health and Human Services. Their mission is to improve access to care and to strengthen delivery and just to build healthy communities. So that's their mission. And we also get some funding through the county's general fund.
So there's a variety of sources that are making the van possible.
There are.
And where does the van go? I mean, how do people actually find it so they can utilize the services?
Again, back to the website, www.pinellescounty.org/human services. We have a flyer that we send out to the local outlets that interface with the homeless population often. Where we go is throughout Pinellas County. We go to 3 locations in Clearwater and 2 in St. Pete. The Clearwater locations are St. Vincent de Paul, which is on Park Street in Clearwater. We go to Pinellas Safe Harbor, which is located near the jail. We go to Pinellas Hope, which is right up the street off of 49th on 126th Avenue. We also go to 2 locations in St. Pete, Salvation Army Adult Rehabilitation Center and Salvation Army One Stop.
So it goes to quite a few places
We
where
do.
folks actually find homeless services.
We go to where the homeless are, and the homeless are, generally speaking, accessing services at those locations or living at those locations.
And I'm sure it fluctuates, but are you able to give any kind of an estimate on the number of patients that you see in a month?
We see, give or take, obviously it absolutely does fluctuate. We see about 110 clients a month. Our annual total last year was 2,800. We're on pace, though, this year to see more like, not 2,800, 1,280 annually. We're on pace this year to see about 2,000, which works out roughly to about 170 clients a month.
That's an amazing number of individuals, and I just have to ask, what would happen if the van didn't exist for those individuals?
Well, the short answer is the options are limited. The folks that we deal with, generally speaking, would either, and let me say that some of those folks, we do have a little bit of some eligibility factors that have to be met, but it's possible for those folks to receive treatment in any one of our 5 medical homes. Our homeless people can go to the free clinics that are in the area, which are the downside of that is that they don't provide funding for specialty care, and the prescription assistance is limited. and or the emergency room. Generally speaking, a lot of our folks end up in the emergency room where their care isn't followed, can't be followed. Luckily, though, in Pinellas County, we have a Board of County Commissioners that is dedicated and caring about this population. So at least here, our homeless have an option that caters to them.
Which is so important to know that we do have such a caring community where those who are oftentimes the most vulnerable do have access to good quality health care.
It can't be understated how important it is.
Anything else we need to know about the mobile medical unit?
Yes, I would like the audience to know that the people that are on the van, the doctors, the nurses, they work under some fairly difficult circumstances in a lot of cases. They deal with patients that have put off care and are complicated medical situations, and they deliver a service with compassion and grace, and they do an amazing job, and we're very proud of our mobile van.
That's great, and we're so fortunate to be able to have them right here in our own community, helping
Yes,
others.
Absolutely.
Great. Dale, thank you so much for joining us and providing the very informative overview of the mobile medical unit. I'm sure a lot of people weren't aware that you had that, and it's doing great things for a great number of people.
Thanks, Jane.
Thank you.
Appreciate it.
Additional details on the mobile medical unit can be found on the county's website at www.pinellascounty.org/human services, or you can call 727-464-4763. That's all for this edition. I'm Jane Merlin, hoping you stay in touch with us. Thanks again for tuning in today. See you next time.